The emergency room went dead silent at 11:47 p.m. Not the normal quiet, not the between-patient lull where monitors hum and nurses swap charts. This was the kind of silence that happens when a 6'2" Special Forces operator covered in his own blood gets wheeled through trauma bay doors and locks eyes with a nurse standing near the supply cabinet, a nurse nobody in that room had ever taken seriously, and says, through cracked lips and a jaw clenched so tight it looked like it might shatter, "Her. Only her." Dr. Victor Hale stepped forward, gloves already on, ready to assert control the way he always did. The soldier's hand shot out and grabbed the gurney rail so hard the metal bent. I said, "Only her." Then the radio on the soldier's vest crackled through the static, and a voice came through the speaker cold and flat as a blade. "Echo Medic is on site. Repeat, Echo Medic is confirmed on site." Every person in that trauma bay looked at the nurse. Olivia Brooks was already moving. If you're watching this for the first time, stay until the end. You won't want to miss what happens next. Hit like, follow along so you don't lose this story, and drop a comment with the city you're watching from. I want to see how far this has traveled. Cedar Falls, Colorado sat at just under 7,000 feet elevation, which meant the air in early November carried a particular kind of bite that visitors always underestimated. You'd step off a plane thinking you knew cold, and the first breath would remind you that you didn't. Locals called it attitude adjustment. The mountains didn't care who you were when you showed up. You either adapted or you suffered. Olivia Brooks had grown up in a town 2 hours south, with a population small enough that everyone knew your name before you had a chance to introduce yourself. She'd left at 18, been gone for nearly a decade, and come back to Colorado 3 years ago for reasons she hadn't fully explained to anyone at Riverside Regional Medical Center. Not because she was hiding anything exactly, but because explaining herself had never been something she was good at, and she'd stopped trying to be. She'd been working ER nights for 13 months. She was 32, though most of the attending staff assumed she was younger, which she'd stopped correcting because the correction always made things worse. She kept her dark hair pulled back in a low bun that was never quite neat. Strands would escape by hour 3 of any given shift, and she'd stop noticing them. She wore her scrubs a size too large. She didn't wear jewelry. She carried a secondary penlight in her left breast pocket in addition to the standard one because she'd learned, somewhere she never specified, that lights failed at the worst possible moments and you should always have a backup. She was, by most accounts at Riverside Regional, forgettable. That was the word Dr. Victor Hale had used 3 weeks into her employment during a department staff review in front of 4 other nurses and 2 residents when he'd reviewed her latest performance notes and said, without looking up from the clipboard, "She's forgettable. Technically proficient, no instincts, no initiative. Keep her on supply check and intake processing. She'll do less damage there." No one in the room had corrected him. Olivia had been standing in the hallway when it happened. The door to the meeting room was slightly open. She'd heard every word. She'd stood there for exactly 3 seconds, then walked to the supply cabinet at the end of the hall, did a full inventory count, restocked 2 shelves, and went back to work. That was 13 months ago. Since then, very little had changed. Dr. Victor Hale was 51 years old, the chief of emergency surgery at Riverside Regional, and a man who occupied space with the particular confidence of someone who'd been told he was exceptional so many times that he'd stopped questioning it. He had good hands. He was fast under pressure, technically. He'd been published in the right journals, attended the right conferences, mentored the right residents. The hospital administrator, Dennis Vaught, thought of Hale as the department's cornerstone, and Hale had never done anything to discourage that assessment. What Hale was not good at, though he would never have identified this himself, was uncertainty. When a situation moved outside the lines he understood, he got rigid in a way that looked like control but was actually closer to panic, wearing a calm face. His residents had learned not to push back on him during those moments. The nurses had learned not to push back at all. Olivia had learned both things within her first 2 weeks. She hadn't pushed back. She hadn't made herself a problem. She'd shown up for every night shift, done her assigned work, and stayed, as Hale had instructed, away from the trauma bay whenever he was running it, which was most nights when the cases were serious enough to matter. "Your intake and triage support," he told her during her first month, in a tone that made it sound like a compliment and wasn't. You don't need to be in the room for the complicated ones. It gets crowded. She had said, "Understood, doctor," and stepped back. She had said that phrase, "Understood, doctor," so many times in 13 months that she sometimes caught herself wondering if she'd forgotten how to say anything else. But she kept saying it because she was good at operating inside constraints, and because she'd learned a long time ago that not every battle was worth the cost of fighting it. The ER at Riverside Regional on a Tuesday night in early November was not typically a chaotic place. It was a mid-sized regional hospital serving Cedar Falls and the surrounding mountain communities. And while they got their share of trauma, car accidents on icy roads, backcountry injuries, altitude-related cardiac events, and underprepared tourists, it was not a level 1 trauma center. It was level 2. There were nights when that distinction felt important. Tonight was going to be one of those nights. Olivia was at the intake desk at 11:31 p.m. when the call came in over the hospital radio. She wasn't supposed to be monitoring that frequency. It was technically the charge nurse's responsibility. But charge nurse Pamela Doss had stepped away to handle an insurance dispute in the back office, and Olivia had a habit of staying near the radio when the desk was unmanned. The transmission was fragmented. Military channel cross-patched onto the emergency medical frequency, which wasn't standard protocol and meant someone had done it deliberately. She caught 3 words clearly before static cut back in: trauma, incoming, and a call sign she recognized the structure of even if she didn't recognize the specific designation. She was already moving toward the trauma bay when the ambulance bay doors opened. They didn't bring him in on a standard gurney. They brought him in on a tactical litter, the flat, collapsible kind used in field extractions. And the 2 men carrying it were in civilian clothes that fit wrong over what was clearly body armor underneath. Behind them came 2 more men who weren't pretending to be anything other than what they were, armed, alert, and scanning every corner of the room like they were still in the field. The man on the litter was large, not the kind of large that came from a gym, but the kind that came from doing physically brutal work for years until your body had no choice but to adapt or quit. He was maybe 35, maybe older, hard to tell with the blood on his face. GSW to the left shoulder, lateral torso laceration, obvious fracture in the left forearm. Conscious, but not comfortably so. He was holding himself together through something that wasn't entirely physical. Dr. Hale arrived from the surgery wing 40 seconds after the ambulance bay opened, which was fast for him. He had his gloves on and his game face assembled. "Trauma bay 2, he said, without looking at the patient. "Let's get a pressure read and start a CBC." The man on the litter turned his head. His eyes moved across the room, past Hale, past the 2 residents who'd materialized behind Hale, past the trauma nurse standing at the bay entrance, and stopped. He found Olivia standing near the supply cabinet 12 feet away. She hadn't pushed forward. She'd positioned herself at the edge of the room, which was where she'd been told she belonged. The man stared at her for a second and a half. Then he said, "Her. Only her." His voice was rough and quiet and completely certain. Hale's expression shifted through 3 emotions in 2 seconds: confusion, irritation, dismissal. "Sir, I'm Dr. Victor Hale. I'm the Chief of Emergency Surgery. You need to let us—" I said only her. He reached out and grabbed the gurney rail. The metal made a sound. "I'm not repeating it." The radio on his vest crackled. "Echo Medic is on site. Repeat. Echo Medic is confirmed on site." Nobody in that room moved for 3 seconds. Hale recovered first, which was what he did. He turned toward Olivia with an expression that managed to combine reassurance to the patient with something else entirely aimed at her. A look that said, "Whatever this is, I'll deal with it later," and said pleasantly, "Nurse Brooks will assist with initial assessment. Let's move him." "I'm not talking about assist." The operator's jaw tightened. "I'm talking about she runs it." One of the armed men near the bay entrance had been watching Olivia since the moment they'd come through the doors. He was mid-40s, compact, with the kind of stillness that didn't come from being relaxed. When the call sign came over the radio, he'd looked at her. Now he was still looking at her. And slowly, without breaking eye contact, he straightened into a posture that wasn't quite a formal stance. He was in civilian clothes, no uniform, but communicated something unmistakable. He came to attention for her. Olivia looked at the man on the litter. She looked at his shoulder wound, the angle of entry, the blood saturation on the field dressing, the way he was compensating for it in his breathing. She looked at his forearm. She looked at his face. She said, "What's his blood type?" One of the men carrying the litter said, "Oh, negative." "How long since injury?" 41 minutes. "Was he conscious throughout?" "In and out, mostly in." Hale put himself between Olivia and the litter. Not dramatically. He stepped forward the way he always stepped forward, like it was just the natural order of things that he would be at the center. "I appreciate the patient's preferences," he said, "but this is my trauma bay, and I'll determine—" "Doctor." Olivia's voice was quiet. Not sharp, not loud, just clear. "He has a pneumothorax developing on the left side. You can hear it if you listen. The shoulder wound isn't the priority." Hale turned toward her. "Excuse me?" She had a stethoscope in her hands. She'd taken it from the hook on the wall when she'd first moved toward the litter, a motion so small and automatic that most people in the room hadn't registered it. She held it toward him. "Listen." He didn't take the stethoscope. He didn't listen. What he did was draw himself up to his full height, in the way he did when something had gone sideways and he needed to reestablish the room. "Nurse Brooks," he said carefully, "I'm going to ask you to step back. I'll handle this assessment. He'll code in the next 7 minutes if the lung isn't decompressed. Step back, please." She looked at the operator. He was watching her steadily. His breathing had gotten shallower in the last 40 seconds. She could see the slight deviation in his trachea. Minimal, but there. She could see the way his left chest wall was moving differently from the right. She said, "Understood, doctor," and stepped back. Because she'd learned. Because not every battle was worth the cost. But she positioned herself where she could still see the monitors. Hale moved to the litter with one of the residents and began his standard initial assessment. Focused on the shoulder, focused on the forearm fracture, ordering labs and imaging with the fluency of someone who'd done this 1,000 times. He had. He was good at what he understood. The monitors got the patient hooked up at the 11:44 mark. By 11:46, the oxygen saturation had dropped to 89 and was moving the wrong direction. Olivia was watching the number. One of the residents, a second year named Marcus Teller, glanced over his shoulder at her. He was 27 and knew enough that he hadn't fully calcified his instincts to match whoever was in charge of the room. He saw what the number was doing. He saw where she was standing. He saw the look on her face. He said quietly to Hale, "Sats are falling. Should we reassess the chest?" Hale was mid-instruction about imaging. He didn't look up. "We'll get the X-ray." "The X-ray will take—" "I know how long X-rays take, Dr. Teller." The number hit 87. The operator's eyes had closed. His breathing was audible now. Not loudly, but if you were in the room and you knew what to listen for, you could hear it. The slight catch. The asymmetry. Then the ambulance bay doors opened again. It wasn't another patient. It was a man in a uniform that wasn't hospital staff, wasn't paramedic, wasn't any of the previous men who'd come in. He was wearing Army service dress, which was unusual enough in a Cedar Falls ER that the two nurses near the bay entrance both turned at once. He was a colonel by the insignia. He was moving fast. Behind him were 3 more uniformed personnel. "Where is Echo Medic?" the colonel said. His voice carried across the room without effort. Hale turned. "Sir, this is a restricted medical. I asked where Echo Medic is." He was scanning the room. His eyes landed on Olivia the same way the operators had, as though she'd been the thing he was looking for. He crossed the room in 8 steps and stopped in front of her. "Sergeant Brooks," he said. The room went very quiet. Olivia said, "I'm not active duty, Colonel." "No," he said. "You're not. But my man is dying, and you're the only person in this building who knows what to do about it." He looked at Hale, then back at her. "I understand there's been some confusion about your role here." Hale said, "Colonel, I don't know what you've been told, but—" "Dr. Hale." The colonel's tone didn't change. He didn't raise his voice. He had the kind of authority that didn't require volume. "I'm going to ask you to step aside. This is I'm not negotiating with you." He looked back at Olivia. "Sergeant, your patient." For a second, she didn't move. Not because she was uncertain. She'd stopped being uncertain about this particular category of thing a long time ago. But something in the room had shifted in the last 30 seconds, and she was doing the thing she always did in the first instant of chaos, which was let the information settle before she moved into it. The monitor alarm triggered, sat at 84, heart rate spiking. Olivia moved. She crossed to the supply cabinet on the left wall and opened the third drawer from the top. She pulled a 14-gauge needle, a large bore syringe, alcohol swabs, tape. Her hands moved the way they always moved when things got critical. Not fast in the showy way, but efficient in the way that meant nothing wasted, nothing repeated. "Get me the crash cart within reach, but don't open it yet," she said to Marcus Teller, who was already moving. "I need someone on the bag valve mask. You, get over here." She looked at the second resident, a woman named Grace Park, who'd been hovering at the edge of the bay. "Stand by. I may need you moving fast." "What are you doing?" Hale's voice had an edge in it she'd never heard before. "Not authority. Something underneath authority. Needle decompression," she said. "Second intercostal space, midclavicular line. He's got a tension pneumo." "That is not a diagnosis I've confirmed. Listen to his breathing, Dr. Hale." She swabbed the site. "I'm not asking you to perform the procedure. I'm telling you what's happening and what I'm doing about it. You can intervene if you disagree, but you have about 60 seconds to make that call." The room was silent except for the alarm and the operator's labored breathing. Hale did not intervene. Olivia positioned the needle and drove it in. Clean, precise, at exactly the angle that produced the small hiss of escaping air that meant she'd been right about every part of what she'd said. The monitor sound shifted within seconds. Not dramatically, not a movie moment, but the numbers started climbing. 85, 87, 89. The operator exhaled. It sounded like something released. "Chest tube is going to need to follow," she said to no one in particular, reaching for her next materials. "Marcus, I need you on the line. Grace, what's the BP?" 92/60. "Okay, it's going to drop before it comes back up. That's expected." She didn't stop moving. "Forearm needs imaging once we've got him stable. I suspect a radius fracture with possible compartment syndrome developing. The shoulder wound is a through and through. It can wait. Priorities in order: chest, pressure, imaging." She said all of this calmly, the way she might have given a weather report. The colonel stood 3 feet behind her and watched. Hale hadn't moved from the position he'd been in when she'd started. Marcus Teller looked from the patient, whose color was already improving, whose oxygen numbers were climbing with the reliability of something that had been fixed rather than managed, to the nurse who'd fixed him, and then to the chief who'd told her, 13 months ago, to stay away from the complicated cases. He looked like someone trying to rearrange something inside his head and not quite finding where the pieces went. The operator opened his eyes. He found Olivia immediately, the way he had when they'd first brought him in. His breathing was still difficult, but it was breathing, real breathing, not the mechanical failure it had been 40 seconds ago. His face was gray and exhausted and something else. "Told you," he said, barely above a whisper. She taped the needle's position and didn't look up. "Don't talk." "I knew you'd be here." He paused to breathe. "When they said Cedar Falls, I knew. You can tell me about it later. Right now you need to be quiet and let your lung reinflate." "Echomedic," he said, and something in the way he said it wasn't a call sign. It was something else, recognition, or something adjacent to it. She said, "Quiet. That's an order." He closed his eyes. Almost, and it was hard to tell, with everything, almost smiled. The monitor alarm cut off as the SAT hit 93 and kept climbing. In the silence that followed, the trauma bay felt different than it had before, not quieter. The sounds were the same, the monitors and the ventilation and the distant noise of the rest of the ER. But the balance of the room had shifted in some fundamental way, and everyone in it felt it, and nobody said anything yet, because saying something would have meant acknowledging it, and none of them were ready for that. Dr. Victor Hale stood at the edge of the trauma bay with his gloves still on and his hands at his sides, and looked at the patient whose life had just been saved by the nurse he'd told to stay out of the room. He looked at the colonel, who was watching him. He looked at Olivia, who was not looking at him at all. She was watching the patient, tracking his breathing, checking the tape on the needle decompression, doing the quiet and continuous work of keeping someone alive. He opened his mouth. He closed it. Outside the hospital, somewhere in the parking structure or the emergency access road, or somewhere close enough that they all felt the vibration before they heard the sound, the rhythmic thud of rotor blades cut through the cold November air. The colonel pulled out his phone and read something on the screen. He looked up at Olivia. "There are 4 more coming in," he said quietly. "Same engagement, different injuries." He paused. "I need to know if this facility can handle it, or if we need to redirect." Olivia looked at the operator on the table. She looked at the monitors. She looked at the room. She said, "We can handle it, but I need full authority in this bay." She was still not looking at Hale. The colonel said, "You have it." And somewhere down the corridor, the ambulance bay doors opened again, and the sound of the Blackhawk's rotors filled the emergency room like a verdict. 4 casualties came through the ambulance bay in 11 minutes. Not 4 at once. They staggered them, which was the right call, because a simultaneous arrival would have overwhelmed the intake corridor and created a bottleneck that cost time nobody had. Someone on the military side understood trauma logistics. Olivia noted that without comment and worked with it. The first was a leg wound, femoral involvement, tourniquet already applied in the field, applied correctly, which told her something about whoever had been with him before transport. She checked the tourniquet, confirmed placement, marked the time on the patient's forehead with a surgical marker, the way she'd been taught to do in places that didn't have clipboards and intake forms, and directed Grace Park to maintain pressure monitoring while she moved to the second arrival. The second was worse. Blast injury, right side, with the particular pattern of shrapnel distribution that meant the source had been close and low. He was unconscious but breathing, and his breathing had a sound she didn't like. Not the same tension pneumo she'd dealt with on the first operator, but something adjacent. She spent 90 seconds with him, gave rapid orders to a trauma nurse named Sandra Reeve who'd materialized beside her, and moved to the third. Marcus Teller was handling the third when she got there. He'd made 2 correct calls without being told to, which she registered and filed away. She adjusted one thing, the angle of an IV line that was going to cause problems in the next 20 minutes if left as positioned. Showed him why without making it a lesson, and moved on. The 4th arrival was the one that took her a full minute to assess, because the 4th arrival was the youngest person she'd seen come through those doors in 13 months of working this ER, and he was not a soldier. He was maybe 19. He was in civilian clothes, jeans, and a canvas jacket, one boot missing, which she'd seen happen in blast scenarios when one foot absorbed more force than the other. He had a lanyard around his neck with some kind of identification credential, and he had a head wound that was bleeding dramatically the way head wounds did even when they weren't the most critical thing happening, and he was conscious and terrified in the specific way of someone who hadn't been trained to handle being terrified. "Hey," she said, coming into his line of sight deliberately. "Look at me." His eyes found her. They were brown and wide and very young. "What's your name?" "Theo," he said. His voice shook. "Theo Marsh." "Okay, Theo. Are you with the military unit?" I'm a contractor, tech systems. I wasn't supposed to be." He stopped. His breathing was fast and uneven. "It doesn't matter what you were supposed to be. You're here now. I need you to slow your breathing down. In through the nose, out through the mouth, slower than you think you need to. Can you do that?" He tried. He was bad at it. Most people were, the first time with blood running down their face and the sound of rotor blades still ringing in their ears. "Slower," she said. She put 2 fingers on his wrist without making a production of it. Pulse check that didn't look like a pulse check, because alarming a conscious patient with visible clinical assessment was counterproductive. "Keep going. You're doing it." He wasn't, really. But the instruction gave him something to focus on, and that was the point. She assessed the head wound. Scalp laceration. Significant, but not the source of his primary danger. The way he was holding his right arm without seeming aware he was holding it told her more. She touched his ribs on the right side, and he flinched hard. 2 or 3 ribs, she said, mostly to herself. "Are you having trouble taking a full breath?" "Yeah." "Since when?" "Since maybe 20 minutes after. Not right away." "Okay." She looked at Sandra Reeve, who'd followed her from the second patient. "Get him into Bay 4, chest X-ray, rib series." He's got a possible hemothorax developing, but I want imaging before I make that call. Watch his SAT. If it drops below 92 before the imaging comes back, come find me." "Got it." Theo Marsh grabbed her wrist as she started to move. Not hard. He didn't have the strength for hard, just enough to stop her. "Is everyone else?" He couldn't finish it. She looked at him for a second. "I don't know yet," she said. "I'm still working on that." She pulled her wrist free, not unkindly. "Let me do my job." She turned back toward the main trauma bay and nearly walked into Dr. Victor Hale. He had not left. She'd been aware of his presence in her peripheral vision throughout the last 11 minutes. Aware the way you were aware of something that might become a problem, that you monitored without focusing on because focus was required elsewhere. He'd moved around the edges of the bay, she thought, watching. She hadn't had time to track him more specifically than that. He was standing in the corridor between the intake area and the bay, and his expression was something she hadn't seen on him before. Not anger. She'd seen his anger. It had a specific shape, and she recognized it. This was something else, something that sat underneath anger and was quieter and less comfortable. "You bypassed imaging on the first patient," he said. "I didn't bypass it. I sequenced it." She kept moving. "Imaging after stabilization, standard field triage protocol." "This isn't a field. Tonight it is." She turned into the main bay and he followed her, which she'd expected. The tension pneumo was going to kill him before any image was useful. You knew that. "I was building toward..." He had 60 seconds. She checked the first operator's monitor without breaking stride. Sat at 97. Stable. "I'm not arguing with you about the call I made. The call was correct. The patient is alive. And I have 3 more people who need attention. If you want to have this conversation, we can have it when the shift is over." Hale stopped. She didn't. The colonel, she still didn't know his name, hadn't asked, hadn't had time, was standing near the bay entrance with his phone in his hand and a look on his face that had been there since she'd begun working. A look of focused observation that reminded her of people she'd known in another context. He stepped aside as she passed without being asked to. "How are they?" he said. "Too stable, too being assessed. Ask me again in 20 minutes. The young one, Marsh, he was attached to the unit as a civilian contractor. He's not military, but I know he's not military. He's getting the same care as everyone else." She glanced at him. "That's not a complaint. I'm telling you I know." The colonel nodded once. She moved back to the second arrival, the blast injury, and found Sandra Reeve there with an update that required Olivia to revise 2 of her initial assessments, which she did without apparent difficulty. She'd learned early that revising an assessment wasn't failure, it was information. You worked with what you knew, and when you knew more, you worked with that. People who couldn't revise got people killed. The bay had developed its own rhythm by now. Not the rhythm it had when Hale was running it. That rhythm was organized around his preferences and his pace, with everything calibrated to his authority. This rhythm was faster and less ceremonial, and it worked because everyone in it had stopped waiting for permission and started tracking the work itself. Marcus Teller caught her eye across the bay and held up 2 fingers, then pointed at the monitor on the first operator. She read the question, "Is he going to need surgery tonight, or can we manage this?" and held up 1 finger, then made a flat gesture with her palm. "Manage." "Not yet." He nodded and went back to what he was doing. It was 12:31 a.m. when the immediate crisis stabilized enough for her to take 3 consecutive minutes without moving to a new emergency. She stood near the nurse's station at the edge of the bay and did what she always did in the first moment of relative calm. Nothing visible. She stood still and ran through everything she knew and everything she didn't know, and the gap between them, which was where the next problem was usually hiding. The colonel materialized beside her. He'd been doing that, appearing at her elbow without announcing himself, which was a specific skill, and she recognized it. "His name is Staff Sergeant Dale Rourke," he said quietly. "The first one. The one who asked for you." "I know his name," she said. "It was on the intake form." A pause. "How long has it been?" She knew what he was asking. 6 years. "He said he'd know where to find you if he ever needed you." She didn't answer that. "He also said," the colonel continued, that you were the best medic he'd ever worked with, and he's worked with a lot of medics. He needs a chest tube placed before morning. The needle decompression bought time. It's not a solution. I understand that. I have a surgical team inbound. Your surgical team can assist. The procedure is going to be done here. She looked at him directly for the first time in several minutes. That's not negotiable. The colonel held her gaze for a moment. Then he said, "No, it's not." She went back to work. What Olivia had not done in the 93 minutes since Dale Rourke had been wheeled through the ambulance bay doors was explain herself. She hadn't told anyone in the hospital why a special forces operator had refused treatment from a chief surgeon and asked for her by name. She hadn't addressed the call sign that had come over the radio. She hadn't responded to the look on the faces of the nurses and residents who were beginning to understand that something significantly larger than a standard trauma case was happening in their emergency room. She'd worked. That was all she'd done. The same way she'd been working for 13 months, except that tonight, no one had told her to step back. Dr. Pamela Doss, the charge nurse, had returned from the administrative wing at 11:58. She'd heard the rotor blades, heard the volume of activity that carried through the hospital's corridors, and come running. She'd arrived to find the trauma bay operating at a capacity and efficiency she hadn't seen since she'd worked a mass casualty event in Denver 7 years earlier, and the person running it was the nurse she'd always thought of, with some vague guilt, as background staff. Pam had stood in the bay entrance for 30 seconds watching Olivia work. Then she'd walked to the supply room and started pulling everything she thought might be needed in the next 2 hours and bringing it, without being asked. At 12:44, Victor Hale did something that surprised everyone who observed it, including himself. He picked up a chart. One of the secondary patients, not the critical cases, but a man with significant soft tissue damage and a hematoma that needed monitoring, and he began managing it, correctly, without being directed to. He didn't announce it. He didn't make it a statement. He just did it, in the quiet and almost invisible way of someone who had decided, without fully articulating the decision, to be useful. Olivia noticed. She said nothing about it. It was 1:17 a.m. when Dennis Vaught, the hospital administrator, arrived. He was not a man who typically appeared in the emergency department at this hour. He was a man who appeared in his office and in conference rooms, and at functions where his presence meant something institutional and decorative. He was 63 years old and wore the specific expression of someone who had been woken from sleep and had been given enough information on the phone to be alarmed, but not enough to be oriented. He saw the military personnel first. That was impossible to miss. 3 uniformed Army officers in his emergency department, 2 armed men in the intake corridor, a Black Hawk helicopter that his security team had called him about, and that was currently sitting in his east parking lot. Then he saw the trauma bay. Then he saw Olivia. He looked around for Hale, located him managing a secondary patient with an uncharacteristic quietness, and crossed to him. "Victor," he said, keeping his voice low. "What in the hell is happening?" Hale looked up from the chart. He had a look on his face that Vaught didn't recognize, which was unsettling in itself. He'd known Hale for 11 years, and he thought he knew all the man's expressions. "We have 5 military casualties," Hale said, "all currently stable." "Why is there a—" Vaught gestured toward the bay, toward Olivia. "Why is a floor nurse running the trauma bay?" Hale set the chart down carefully. "Because," he said, "she's better at it than I am." The sentence sat there between them like something that had been dropped and couldn't be picked back up. Vaught stared at him. "I'm sorry?" "You heard me, Dennis. Victor, she's a—" He stopped himself, looked again at the bay, at the monitors, all of which were reading in ranges that meant people were alive and staying that way. At the residents who were working with a focused efficiency he didn't usually associate with the night shift. At the colonel, who had caught Vaught's eye from across the room and was watching him with an expression that was not friendly. "She's a floor nurse," he finished, quieter than he'd started. "She's not," Hale said. "I don't know what she is, but she's not what I told people she was." It was the closest thing to an admission Vaught had ever heard from him, and it landed badly because it had implications Vaught could see radiating outward like cracks in glass. The colonel crossed the room toward them with the particular economy of movement that came from years of not wasting steps. "Mr. Vaught," he said. "Colonel James Harwick, U.S. Army. I need a few minutes of your time." "Colonel, It won't take long." He glanced at Hale. "You should probably both hear this." He led them into the small consultation room off the main corridor, the room where doctors delivered bad news to families, which had a particular energy that never quite went away no matter how many times the walls were painted. He closed the door. He did not sit down. "The woman running your trauma bay," he said, "is Sergeant First Class Olivia Brooks, formerly of the 75th Ranger Regiment's attached medical support element. She completed 3 combat deployments over 4 years. She was cross-trained with Special Forces medical teams on 2 of those deployments. She has personally performed emergency surgical interventions in field conditions that most trauma surgeons in civilian institutions have never encountered in controlled settings." Vaught said, "Why didn't her personnel file?" "Because she didn't want it there," Harwick said. "That was her choice. She separated from service honorably, she was entitled to a private life, and nothing in her civilian employment requires disclosure of her service record." He paused. "What your institution chose to do with her in the absence of that information is a separate matter." The room was quiet for 3 seconds. "What do you mean, what we chose to do with her?" Vaught said. Harwick looked at him steadily. "I've been in this building for 2 hours. I've observed your trauma bay. I've spoken with several members of your nursing staff while waiting for my people to stabilize." He let that sit. "I'm aware of the conditions under which Sergeant Brooks has been working here." Vaught's eyes moved to Hale. Hale's jaw was set. He was looking at the floor. "Colonel," Vaught said carefully, "whatever concerns you have about our internal—" "My concerns," Harwick said, "are currently focused on my 5 personnel, one of whom would not have survived the next hour without the intervention of the nurse your chief surgeon told to step back." He picked up his phone from the table. "The Army's concerns may be broader. I'll let the appropriate people determine that." He opened the door and walked out. Vaught stood in the consultation room and felt something he hadn't felt in a long time. The specific vertigo of understanding that a decision had already been made somewhere above his authority, and all that remained was for him to find out what it was going to cost. He looked at Hale. "How long?" he said. Hale understood the question. 13 months? "And you never—" "I assessed her based on what I saw." Hale's voice had the hollow quality of something said out loud, because silence was worse. "I didn't dig further. You told me she was forgettable." Hale said nothing. "Victor," Vaught's voice dropped, "you told me that in a staff review, with witnesses." Hale set his hands flat on the table and looked at them. They were good hands, steady hands, the kind that had done difficult things correctly thousands of times. Right now they looked like they belonged to someone he didn't entirely recognize. "I know what I said," he said quietly. In the trauma bay, Olivia was beside Dale Rourke's bed. The immediate danger had passed. His oxygen was stable. His pressure was climbing. The needle decompression was holding until the chest tube procedure could be properly set up. He was awake. Not comfortably. Not freely. But awake in the way that meant something had chosen to stay. He looked at her. "You didn't tell them," he said. "Tell them what?" "About Kandahar. About the river crossing. About—" He stopped for a breath. "Any of it. It wasn't relevant to the job. It's who you are." "It's what I did," she said. "There's a difference." She adjusted the tape on his IV line. "And it wasn't their business." He was quiet for a moment. "They treated you like—" "I know how they treated me." "Didn't it make you—" "Dale?" She said his name the way she'd said it before, not unkindly, but with finality. "I know how to operate in hard environments. This was a hard environment. I worked in it." She looked at him. "I was waiting for the moment when the work was what mattered and nothing else did. That's tonight." He studied her face. "You haven't changed." "I've changed a lot." "Not the part that counts." She didn't answer that. She checked his chart, made a notation, and was turning to move on when his hand found her wrist again. Stronger than Theo Marsh's grip had been, even in his current state. There's something you need to know, he said. His voice had dropped. About why we were there tonight. About what Harwick hasn't told you yet. She waited. The engagement wasn't random. Someone knew our route. He held her eyes. Someone on the inside of the operation fed our position. We don't know who yet, but the investigation is already running, and he stopped, breathed. It's going to get bigger than tonight, Olivia. A lot bigger. She looked at him for a long moment. Rest, she said. Did you hear what I heard you. Rest anyway. She freed her wrist. You can't tell me anything useful if you're dead. She walked back toward the center of the bay, and she had taken maybe 4 steps when the doors to the trauma wing opened and 3 people in civilian suits walked in. Not hospital staff, not military, not the kind of people who arrived at hospitals in the middle of the night by accident. The colonel looked up from his phone. His expression, for the first time since he'd arrived, showed something that might have been concern. One of the suited figures held up a credential wallet. Colonel Harwick, the woman in front said. Federal Task Force. We're going to need to secure this facility and speak with your personnel. She paused, and her eyes moved across the room and landed, with the precision of someone who'd been briefed, on Olivia. And we're going to need to speak with her. Olivia didn't move toward the federal agents. She didn't move away from them either. She stood where she was, in the center of the trauma bay, and looked at the woman who had spoken. Mid-40s, dark blazer, the kind of flat professional composure that came from years of walking into rooms where people didn't want her there. I have patience, Olivia said. I understand that. We're not asking you to leave them. The agent took 2 steps forward, keeping her hands visible in the way of someone trained to appear non-threatening and mostly succeeding. Agent Dana Reyes, FBI Joint Task Force. We need to talk. Then talk. I can listen while I work. Reyes glanced at the bay, at the monitors, the personnel, the 5 military patients in various states of stabilization, and made a quick calculation. She nodded. Okay. Colonel Harwick moved to intercept her before she could get further into the bay. Agent Reyes, my people are still critical. Whatever you need from my unit can wait. It can't, actually. She didn't break stride. Colonel, I understand your position. I need 5 minutes with Sergeant Brooks, and then I need to speak with you and your people separately. I'd suggest we cooperate rather than spend time establishing jurisdiction, because we both know how that conversation ends, and it wastes time neither of us has. Harwick held her gaze for a moment, then stepped aside. Olivia was checking the chest tube setup for Dale Rourke when Reyes reached her. The equipment had arrived from Surgical Supply 8 minutes earlier, and she'd been doing the prep work in parallel with managing the secondary patients. The way you had to do things when resources were stretched, and timing mattered. Sergeant Rourke told you about the compromise, Reyes said, keeping her voice low. Olivia didn't look up from what she was doing. He told me someone fed their position. That's correct. We've been running a parallel investigation for 6 weeks. Tonight's engagement wasn't an accident. It was targeted. Someone with access to classified routing information sold it. She paused. The unit's position, their timeline, their personnel list, all of it. Why are you telling me this? Because Sergeant Rourke's medical file, his current file, updated this evening, is already inside a classified network, and someone accessed it 22 minutes ago from an internal hospital terminal. Olivia went still for exactly 2 seconds. Then she resumed what she was doing. Which terminal? She said. 3rd floor administrative wing. We're pulling footage now. Reyes watched her work. You're not surprised? I'm always surprised, Olivia said. I just don't always show it. She sealed the last connection on the chest tube setup and turned to face Reyes fully. What do you need from me specifically? You have clearance history we can use to expedite access to certain personnel records, and Reyes stopped. Something shifted in her expression. Not softening exactly, but a kind of recalibration. Rourke flagged you as the most operationally aware person in this building. He said if something went sideways tonight, you'd see things the rest of us would miss. He's generous. He's also usually right. Reyes handed her a card, physical, paper, which was deliberate. When you have a moment, tonight, if possible. She moved away to find Harwick. Olivia looked at the card for 1 second, then put it in her breast pocket next to the backup penlight, and went to perform a chest tube insertion on a man who would have been dead an hour ago if she'd stayed in her lane. The procedure took 19 minutes. Not because it was complicated, for her it wasn't, or rather it was the kind of complicated that had long since become manageable, but because Dale Rourke's left pleural space had accumulated more blood than the initial imaging had fully captured, and she had to work carefully through that without rushing, because rushing a chest tube when you had unexpected hemothorax was how you turned a bad situation into a catastrophic one. Marcus Teller assisted. He didn't ask questions she hadn't invited. He handed things when she needed them handed, held retraction when she asked, and monitored the drainage when she needed her attention elsewhere. Afterward, when Rourke was settled and the output was tracking correctly, Marcus said very quietly, "Where did you learn that approach?" "The sequencing. You did the tube placement before the imaging came back fully." "Cadena," she said, and then realized that meant nothing to him. "Field hospital, overseas. You work with what the patient's body is telling you, not what you're waiting to confirm on film. The film catches up." He absorbed that. Dr. Hale always says imaging first. Dr. Hale has never worked without imaging. She stripped her gloves. Both approaches have their logic. In a controlled environment with stable patients and time, his is defensible. Tonight wasn't that. He nodded slowly. Not deference, something more like genuine processing. She'd met enough young residents to tell the difference. At 1:53 a.m., Theo Marsh's imaging came back. She reviewed it at the nurse's station, and what she saw made her very quietly revise her earlier assessment from possible hemothorax developing to confirmed hemothorax. Small, likely to be managed conservatively, with a third notation that the 2 fractured ribs were clean breaks rather than the more complicated comminuted type, which was actually the best news she'd gotten in the last 2 hours. She went to tell him. He was propped up at 30 degrees. Sandra Reeve had done that correctly, which helped. And he looked worse than he had earlier in the way that people sometimes looked worse once the adrenaline fully left and the body started accounting for what had happened to it. His face was pale, and the laceration on his forehead had been butterfly closed but was still an uncomfortable thing to look at. He looked at her when she came in, and something in him visibly settled, which was a thing that happened sometimes that she'd never entirely gotten used to. 2 broken ribs, she said, bleeding in your chest cavity, but not much. We're going to watch it rather than intervene surgically unless it gets worse. She sat on the edge of the chair beside the bed. Not standard practice, she'd been told once, but it changed the dynamic in ways that were clinically useful. You're going to feel worse before you feel better. That's not a concern. It's just the process. "Okay," he said. And then, "Is Rourke stable?" "I thought he was—" He stopped. "He wasn't. He's stable." She watched him absorb that. "You want to tell me what happened out there?" He looked at the window. Cedar Falls at 2 in the morning was entirely dark in that direction, the mountains invisible against the sky, existing only as a weight in the air. "I'm not supposed to," he said. "You're a civilian. That restriction is softer than you think it is." A pause. "I don't actually know the full—" He stopped again. "I was on my 2nd week. The system I was there to support was communications infrastructure, encrypted relay equipment." He looked back at her. "Something jammed us right before the contact. The entire system went dark for about 4 minutes, and then they were—" He didn't finish that either. She didn't push. Some things closed when you pushed, opened when you waited. "The equipment that failed," he said eventually, "the system I maintain. It shouldn't have been jammable. The specs say—" He let out a slow breath that caught on his broken ribs and made him wince. "Someone who knew the specs found a way." Olivia looked at him. "How many people know those specs?" "Outside my company, maybe a dozen." He held her eyes. "Inside my company?" "More than that. But the outside people are the ones with access to. They'd be the ones who could pass it on." She stood up. "Don't tell anyone else what you just told me." He looked alarmed. "Should I not have told—" "You told the right person. Just don't add to the list." She moved toward the door. "I'll be back to check on you." The federal agent, Reyes, was in the corridor with one of her colleagues in Harwick when Olivia emerged from Theo Marsh's room. All three of them were looking at a tablet that Reyes was holding, and the body language of all three was the particular stillness of people looking at something they didn't want to be looking at. Olivia stopped beside them. Reyes turned the tablet so she could see. It was a still from hospital security footage, the third-floor administrative wing, timestamp 1:09 a.m. The image showed the back of someone in scrubs, seated at a terminal, face partially obscured by the angle. "Recognize them?" Reyes said. Olivia looked at the image. The scrubs were dark blue. That was the standard color for the hospital's administrative nursing staff, a specific subset. The build, the posture, the way the person was sitting, slightly forward, left shoulder higher than the right, the particular way of holding the neck. "Get me a better angle," she said. "This is the best we have from that camera. We're pulling adjacent cameras now." "You don't need the adjacent cameras." She looked at the image for another 3 seconds. Then she said, "That's not a nurse." Reyes looked at her sharply. "The scrubs are right. The posture isn't. Nurses don't sit like that. We spend too many hours on our feet to sit with all our weight forward when we finally get a chair. That person isn't used to sitting in scrubs." She pointed at the screen without touching it. "See the shoulder? That's someone who usually wears a jacket, something with more structure. And the way they're holding the neck, that's a person who normally sits at a desk, not a nursing station, a desk with a higher monitor." Hark was looking at her with the expression she'd seen on him several times tonight. Not quite surprise, more like the confirmation of something he'd already expected. Reyes said, "Administrative staff? Or medical. Attending level, maybe. They're used to standing over patients, which is why the neck position is..." She stopped. "Get me the adjacent camera footage." Reyes looked at her colleague. He had the footage up in 40 seconds. The adjacent camera caught a different angle, partial, just the left side of the person's face as they stood to leave the terminal. Not enough for a clean ID, but enough to see the lanyard. The lanyard was hospital issue, Cedar Falls blue, and the ID badge at the end of it. The image was low resolution, the timestamp compression had degraded it. Showed a photo, and, barely legible, a department designation. Olivia saw it clearly enough. Surgery. She felt something tighten in her chest that had nothing to do with her own physiology. "I need to check something," she said. She walked back toward the trauma bay before anyone could ask her what, and she did it at the pace that looked like normal hospital movement and was actually controlled urgency, because whatever was happening had crossed from medical emergency into something else, and she needed to think about it clearly before she said anything she couldn't unsay. Victor Hale was still in the bay. He had not left, and she'd checked, peripherally, several times. He was on his third secondary patient now, a methodical and competent management of injuries that didn't require her involvement, which meant he'd found a way to be useful without being in her way, and she didn't know entirely what to make of that. She looked at him. Then she looked at the secondary nurse's station where his jacket was hanging. He'd taken it off when he'd started working. She'd seen him do it, hours ago. It was a well-fitted jacket, structured, the kind of thing a man in his position wore to communicate a certain kind of authority. She looked at the timestamp on the security footage in her head. 1:09 a.m. She'd been performing the chest tube on Rourke from 1:11 to 1:30. Before that, between 12:50 and 1:09, the bay had briefly cleared of most personnel during a supply-resupply rotation. She'd been at Rourke's bedside for those 19 minutes, largely alone with Marcus. She thought about where Hale had been during that window. She had not tracked him closely enough. She'd been monitoring him the way she monitored everything that wasn't the primary emergency. Peripherally, imprecisely. She knew he'd been in the bay at midnight. She knew he'd been back by 1:30. The window between, she walked to his jacket. Not fast, not furtive. She checked the inside left pocket, not because she had the right to, but because something in the last 5 minutes had rearranged her priorities, and if she was wrong, she would deal with the wrongness later. The pocket held a phone, a pen, and a folded piece of paper. She left all of it. She walked to Hale directly. "Where were you between 12:50 and 1:09? She said. He looked up from the chart with an expression that started as mild irritation at the interruption and then changed into something she couldn't read. I took a break. Coffee. The break room on 3. "What floor is the administrative wing?" His expression finished changing. 3, he said. Why? She looked at him for a long moment. He had good hands. He'd worked hard tonight. She'd watched him. He'd made the admission to Vought that she knew had cost him something real. He had not left when he could have left. None of that answered the question. Agent Reyes needs to speak with you, she said. About what? She'll tell you. She started to move away. He caught her arm. Not hard, but definite. Olivia. He said her name for the first time tonight, not Nurse Brooks. Her name. What did you see on that footage? She looked at his hand on her arm. He released it. I don't know yet, she said. That's the honest answer. She returned to Reyes. The agent was still in the corridor, but her colleague had moved, gone to join a third agent who had just come through the main entrance from the parking lot. The third agent was holding an evidence bag. Inside it, visible through the clear plastic, was a laptop. Small, dark, unremarkable. Reyes looked at Olivia. Found in the east stairwell. Second floor landing. Someone left in a hurry. Is it hospital issue? No, personal. We're pulling the registration now. She paused. What did you want to tell me? Olivia told her. All of it. The footage, the posture read, the shoulder analysis, the lanyard, the jacket, the timeline, her conversation with Theo Marsh. She said it in the same order she'd assembled it, without editorializing, without inflation. Reyes listened without interrupting. That was, Olivia had found, the mark of someone who actually knew how to gather information. When she finished, Reyes said, You're not naming him. I don't have enough to name him. I have a timeline gap and a posture read from a degraded image. But you think it's Hale? Olivia was quiet for a moment. I think the gap needs to be accounted for. That's all I'm saying. Reyes looked at her colleague with the evidence bag. Then she looked back at Olivia. How long have you worked with him? 13 months. And you never... I didn't know what to look for, Olivia said. I wasn't looking for it. I was looking at the patients. Reyes nodded slowly. Okay, we're going to bring him in for... The trauma bay alarm went off. Not the soft, persistent kind that meant a number had drifted outside normal range. The urgent kind, yeah. The one that meant something had changed fast and in the wrong direction. Olivia was already running before she consciously made the decision to run, which was how it worked when everything was calibrated right. She pushed through the bay doors, and Marcus Teller met her 3 steps in with the look on his face that she'd learned to read in the last 2 hours. Focused, a little scared, doing the right things while wanting very badly to be told he was doing the right things. Rourke, he said. BP dropped. Systolic is 74. Chest tube output spiked. We've got... She was already at the bedside. The chest tube drainage chamber had gone from slow and controlled to dramatic in the last few minutes. More blood than the small hemothorax she'd been managing should have been producing, which meant the picture had changed. She put her hands on Rourke, and he was conscious, barely. And when he opened his eyes, they were the eyes of someone who understood exactly what was happening to them. Still here, he said. Don't, she said. She was assessing with both hands, reading pressure, reading the tube output, reading his color and his breath sounds, and the specific quality of his distress. My fault, he said. I made you... Dale. She looked at him. Shut up and breathe. The chest wasn't the only source. She could hear something she hadn't heard before, a change in the quality of the left lower breath sounds, and combined with the pressure drop and the drainage spike, it pointed somewhere she hadn't been looking because the initial presentation hadn't given her reason to. She turned to Marcus. Get me a fast exam. Ultrasound. Now. Left upper quadrant. You think spleen? I think I want to know what the ultrasound says. She took the probe when it appeared. She ran it herself. The image came up on the portable screen and told her what she'd suspected and didn't want confirmed. Significant free fluid. Left upper quadrant. More than could be explained by the chest. The spleen. Delayed splenic rupture. Possible in blunt trauma. Easy to miss in initial assessment when the primary complaints were thoracic, presenting hours later when the injury site finally gave way. He needs the OR, she said. Now. Not in 20 minutes. Now. Grace Park had the phone before she finished the sentence. Marcus looked at the screen and then at her. How did you... The breathing changed 20 minutes ago. I heard it and filed it. She handed the probe back. I should have acted on it sooner. It was the first time tonight she'd said anything like that about her own performance. It landed differently than she'd expected. Not self-condemnation, just factual accounting. The kind you did because the next time would be better if you did. Rourke's hand found her wrist again, weaker than before, much weaker. The name, he said, the person who sold us out. I know who it is. I've been trying to... He coughed. My vest, inside pocket. There's a card, a business card. I kept it because you can tell me after surgery. If I don't make it through, you're going to make it through. She held his hand for exactly 3 seconds, which was longer than she typically allowed herself, and then she released it. But if you want to hedge, tell the FBI agent in the hallway. That's her job, not mine. He almost smiled again. The same almost as before. The OR team arrived at a controlled run. Not the frantic scramble of a system in crisis, but the organized urgency of people who knew what was coming and had prepared for it. They had 2 attending surgeons, which was unusual for this hour, and she realized Harwick must have made calls while she'd been in Marsh's room. She stepped back as they took over the transport. She stepped back and stood there and watched Dale Rourke be rolled out of her trauma bay toward a surgery that he might or might not survive, and she felt the particular gap in the chest that happened when you'd done everything you could, and the outcome was no longer in your hands, and you had to let that be true. It took about 4 seconds. Then she turned around. Agent Reyes was standing in the bay entrance with the evidence bag and a look on her face that had acquired a new quality. Urgency with direction, which was different from urgency without it. The laptop, she said, registered to a private shell company, but the service history traces to a repair shop in Denver, and the shop has records. She paused. The name on the repair authorization is Hale. Olivia absorbed that. There's more. Reyes held up her phone. A second image, cleaner than the security footage, pulled from a different source. The adjacent camera footage you asked for. We got a better extraction. The image was clearer. Left side of the face. The badge. She could read the name now. It wasn't Victor Hale. The badge read, Vought D, Hospital Administration. The floor dropped out of something Olivia had been standing on without realizing it. Dennis Vought. Not the surgeon, not the doctor who'd humiliated her for 13 months, the administrator who'd built the institution around him, who'd attended every staff review, who'd sat in the room when Hale had called her forgettable and said nothing. Reyes was watching her face. He was in the military, Reyes said quietly. 6 years, early career, logistics, procurement. He has the background to understand what he was selling and to who. Olivia looked at the image. He was there tonight, she said. He came in after the military arrived. He was in the consultation room with Harwick and Hale. I know. He heard everything. The personnel status, the timeline, who was critical. I know. Reyes was already typing on her phone. We have people on the administrative wing now. We're moving to pick him up. She looked at Olivia. Where would he go if he knew we were closing in? In this building? In the middle of the night? Where would he go? Olivia thought about Dennis Vought. 63 years old. An administrator's knowledge of the building. Not a doctor's, not a nurse's, but a manager's. Every corner of the structure in terms of budget and function and access. Every exit, every camera blind spot, because the camera budget went through his office. She thought about where she would go. Loading dock, she said. Sub-basement. It's the only exit that doesn't have upgraded camera coverage. He approved the facilities budget that deprioritized it 3 years ago. Reyes spoke into her earpiece. 7 seconds later, the sound of running feet came from the far end of the corridor, and then, distant but unmistakable, a shout, and then another, and then the particular silence that followed when people who knew what they were doing closed around something they'd been looking for. Olivia stood in the trauma bay. The monitors were steady. The bay was quieter than it had been all night. Not empty, but operating at the lower hum of patients who were being maintained rather than emergency being delivered. The crisis portion of the night was either over or had moved somewhere she wasn't. She looked at the bed where Dale Rourke had been. She looked at her hands. Sandra Reeve appeared at her shoulder with a cup of coffee that Olivia hadn't asked for and probably needed, and set it on the counter without saying anything, and walked away. Olivia picked it up. She was still holding it when Marcus Teller came out of Bay 4 and said, in the carefully neutral tone of someone trying not to alarm anyone, "I just got a call from the OR. Rourke is on the table." "I know. They said to tell you—" He stopped, checked the note on his phone. "They said, Echo Medic got him this far. The rest is ours." He looked up. "What does that mean?" She drank the coffee. It was bad. Break room drip, left on the burner too long, the kind that tasted like something that used to be coffee and had stopped trying. "It means they know whose patient he is," she said. Marcus nodded. He started to walk away, then stopped. "Dr. Hale," he said. "He's been in the consultation room with one of the federal agents for the last 20 minutes. I don't know if that's—" "It's fine," she said. "Is he in trouble?" She thought about Hale's hands on the patient charts tonight. She thought about the timeline gap. She thought about his jacket on the hook and his expression when she'd asked him where he'd been. She thought about what Reyes had said. The name on the repair authorization is Hale, and what the camera had then shown. She thought about 13 months of understood, doctor, and stepping back and staying out of the room. "I don't know," she said honestly. "I think that's for other people to figure out now." She set the coffee down. She walked back toward the bay, and her pager went off. Not the OR, not Rourke's team, but an extension she didn't immediately recognize, and when she checked the message on the screen, it said 4 words that rearranged the last 3 hours into a shape she hadn't expected. He told them everything. She stared at the pager for 3 seconds. He told them everything. No sender ID. Extension she didn't recognize. 4 words that could mean Dennis Vaught, now in federal custody in the sub-basement, had started talking the moment the agents closed around him. Or it could mean something else entirely, from someone she hadn't accounted for, about a person she hadn't identified yet. She walked to Agent Reyes. Reyes was on her phone, moving toward the main corridor with the particular stride of someone whose night had just gotten significantly more complicated. She held up one finger when she saw Olivia. 1 minute, and Olivia waited because she'd gotten good at waiting, and because the finger meant information was coming rather than being withheld. The call lasted 90 seconds. Reyes ended it and turned. "Vaught is talking," she said. "Hasn't asked for counsel yet, which won't last, but right now he's talking." She glanced at the pager in Olivia's hand. "Where did that come from?" "I don't know. Unknown extension." Reyes took it, looked at the number, typed it into her own phone, and showed the screen to her colleague without showing it to Olivia. The colleague's expression didn't change visibly, but something in his posture shifted. "It came from the OR," Reyes said. "Scrub Nurses Station, second line." Olivia absorbed that. Someone in the OR had sent her that message. Someone who'd been on the table with Rourke and had a phone accessible during a surgical procedure, which was unusual, or someone adjacent to the OR, circulating nurse, anesthesia tech, someone in the prep room, someone who wanted her to know before it became official. "What is he saying?" Olivia asked. Reyes looked at her for a moment with the expression of someone calibrating how much to share and with whom. It lasted about 2 seconds. Vaught had a contact, private security consulting firm, former military contractors. He's been feeding information for 14 months. Not just route data, personnel files, medical records of active duty service members who came through this hospital, equipment procurement schedules. She paused. The unit tonight wasn't the first. There were 2 prior incidents he facilitated. Both were attributed to other causes. 14 months. Olivia's first month at Riverside Regional, Vaught had sat in a staff review and listened to Hale call her forgettable. And he'd said nothing. And now she understood the geometry of that silence differently. A man running an information pipeline out of a hospital didn't want unusual personnel. He wanted predictable ones. He wanted a trauma department that stayed in its lane and didn't look at things too carefully. "The investigation into prior incidents," she said. "Are those cases going to be reopened?" "Already in motion." Reyes said it without drama, which was how Olivia knew it was true. 2 soldiers died in what was logged as equipment failure. We're pulling everything now. Olivia looked at the bay, at the monitors, at the residual organization of a night that had started as an emergency and had become something larger. Hale, she said, is he not connected to Vaught's network? His timeline gap checks out. There's coffee machine footage from the third-floor break room. He was where he said he was. Reyes held her gaze. He's not your problem. He was never my problem, Olivia said. He was my supervisor. She walked back into the bay. The night had passed the point where the difference between midnight and 3 a.m. was visible in any single moment, but it was visible in the accumulated weight of the people who'd been awake through it. Marcus Teller had dark circles under his eyes that hadn't been there when the shift started. Sandra Reeve was moving on the particular autopilot of experienced nursing staff who'd been through long hauls before and knew how to conserve everything except function. Grace Park had taken a 15-minute break somewhere around 2 a.m. and come back with her hair redone, which was the kind of small act of self-maintenance that Olivia had learned to recognize as a coping mechanism, and a good one. The secondary patients, the leg wound, the blast injury man, the others were all in monitored beds now, vitals stable or improving. The immediate danger receded to the slower work of recovery. Olivia made her rounds. Not quickly, not performed. She did it the way she always did the overnight check, room by room, reading each person's face and chart and breathing pattern with the same attention she gave the monitors, because the monitors told you numbers and the patient told you context. The blast injury man, Staff Sergeant Paul Wendell, she'd learned his name in the second hour, was awake when she reached him. He had the look of someone who'd been awake for a while and had been thinking rather than resting, which was common in trauma patients whose bodies had passed through the worst of the crisis and whose minds hadn't caught up yet. "You're the one they called for," he said when she came in. "I work here," she said. "That's not what I mean." He watched her check his chart. "Rourke told me about you, before the deployment, when they were putting together the support list. He said if anything went wrong and they ended up in Colorado, there was someone at Cedar Falls Regional who—" He stopped. He wasn't specific. He's never specific about things that matter. "He made it to surgery," she said. "That's all I know right now. That's all I need to know right now." He was quiet for a moment. "The guy they picked up, the administrator, that's not something I can discuss. I'm not asking you to discuss it. I'm telling you." He shifted against the bed, careful of his injuries, and his jaw tightened for a second before it eased. "I'm telling you that whatever came out of tonight, whatever they found, it goes further than what you're seeing. What Vaught was doing, he was small in the chain. He had access they needed, but he wasn't driving it." Olivia looked at him directly. "You should tell Agent Reyes that," she said. "I will. I am." He met her eyes. "I just wanted someone in this building to know that what you did tonight, what you walked into without knowing what you were walking into, it mattered for reasons bigger than one trauma bay." She didn't know what to do with that exactly, so she did what she usually did with things she didn't know what to do with, which was acknowledge it without performing a response. "Get some rest," she said. "Your BP is still lower than I want." She left the room and almost walked into Victor Hale. He had come from the direction of the consultation room, which meant he'd been with the federal agents. He looked like a man who'd spent the last hour having a detailed conversation about things he hadn't realized he'd been adjacent to. And he looked like that experience had done something to the architecture of his face that hadn't finished settling yet. He stopped when he saw her. She stopped. The corridor between them was empty at this hour, and the distance was maybe 6 feet, and there was no one else to direct the moment toward. "They told me about Vaught," he said. She waited. "I didn't know." He said it without defense in it, which surprised her. Just fact. "I want you to know that." "I believe you," she said. She meant it, which was its own kind of complicated. "I've been—" He stopped. He looked at the wall briefly, which was where people looked when they were trying to locate something honest and hadn't found it yet. "I've been trying to work out how much of what happened in this department was Vaught managing the environment and how much of it was just me." Olivia said nothing. "I think," he said carefully, "that the honest answer is that he benefited from things that were already there, that I provided him with a department he didn't have to work very hard to manage." He looked back at her. I told you to step back from patients for 13 months. I told the administrator you were forgettable. I believe both things when I said them, and I said them without—" He stopped again. "Without looking." "No," she said. "You looked. You just didn't see what you didn't expect to find." It wasn't forgiveness. She wasn't sure it was even absolution. But it was accurate, and accurate was what she had to offer. He nodded once, the kind of nod that wasn't agreement or gratitude, just the acknowledgement that something had been said that needed to be said. "They're going to do an internal review," he said, "of the department, of my supervision record, my staffing decisions." He paused. "Of how we handled your placement." "I know." "You could—" He started and then reconsidered the sentence. "Whatever you say in that review. I'm not asking you to. I just want you to know that I understand I don't have standing to ask you for anything." She looked at him for a moment. "I'll say what's accurate," she said, "the same way I always do." She walked past him toward the nurses' station. The OR called at 3:47 a.m. She was at the station when it came in, which was not coincidence. She'd positioned herself within reach of that phone for the last 90 minutes, maintaining the work of the shift in her hands while keeping part of her attention anchored to that specific extension. Sandra Reeve, who understood these things without being told, had made sure the line was clear. Olivia picked it up on the second ring. The voice on the other end was the attending surgeon, a woman named Dr. Patricia Soll, whom Olivia had met once at a department crossover meeting and had assessed quickly as competent and no-nonsense, which tonight had proven to be an accurate read. "Your patient is out," Soll said. "He's in recovery." Olivia closed her eyes for exactly 1 second. "The spleen?" "Partial resection. We preserved about 40%. "Enough." Soll paused, and in the pause Olivia could hear the particular exhaustion of a surgeon coming off an unexpected middle-of-the-night procedure. "He's going to be angry when he wakes up and finds out what we took." "He'll manage," Olivia said. "He kept saying your name. Under anesthesia, mostly." Another pause. "That doesn't usually happen." "He's dramatic," Olivia said. "It's a personality trait." Soll made a sound that might have been a laugh and hung up. Olivia stood at the nurse's station and breathed for a moment. Not the deliberate breathing she'd prescribed to Theo Marsh, just the involuntary kind. The kind that happened when something you'd been carrying released its weight. She became aware that she wasn't alone. Marcus Teller was at the far end of the station with a chart he wasn't reading, and Grace Park was at the supply cabinet doing inventory she'd already done, and Sandra Reeve was not pretending to be anywhere near her assigned task. All three of them were looking at her with varying degrees of subtlety, which was to say, not much. She looked back at them. "He's out of surgery," she said. "He's stable." The release of tension in the room was physical. She could feel it the way you felt pressure change before a storm broke. Marcus exhaled audibly. Grace put her hand flat on the supply cabinet for a second, like she needed the contact with something solid. Sandra Reeve turned back to her actual work with the particular composure of someone who'd known the right outcome was coming and was not going to embarrass herself by expressing relief too visibly. It was 4:03 a.m. when Colonel Harwick found her. She'd expected him earlier, but the federal agents had occupied most of his time since the situation with Vought had broken, and she understood that. He came into the bay with the measured pace of a man who had processed several hours of significant information and had arrived at something he intended to say directly. He sat down in the chair beside the nurse's station, not across from her, not at a distance that suggested official business. He sat in the chair the way people sat when they were going to talk rather than brief. Vought gave them 9 names, he said. His full network chain, contacts, intermediaries, the consulting firm. He looked at the floor briefly, then back at her. 2 of the names are people I knew. One of them I trusted. She didn't offer anything to fill that with. The 2 incidents before tonight, he continued, we're going back through them. The equipment failure narrative is going to come apart, and when it does, he stopped. 2 of my people died in those incidents. Good people. I'm sorry, she said. Not as a formula, as the actual thing. He nodded. What Rourke told you about the compromise, about knowing something was wrong. He's been carrying that for 3 weeks. He couldn't name it, couldn't prove it, but he knew something was off about the mission structure, and he didn't push hard enough on it, and that's going to be something he lives with. He paused. I wanted you to know that, because when he wakes up, he's probably going to be difficult about it, and you seem like someone who does better with context. He's always been difficult, she said. I've had context on that for a long time. Harwick almost smiled. It didn't fully form. He's lucky you were here. He's lucky he knew where to send the bleeding man, she said. At 4:31 a.m., the thing Olivia had been aware was coming, but had not been able to predict the timing of. The moment where the institution caught up to the night arrived in the form of Dennis Vaught's temporary successor. Evelyn Marsh was the hospital's deputy administrator, 55, a woman who had operated in Dennis Vaught's professional shadow for 7 years, and who was going to have approximately 48 hours to figure out how much of that shadow had covered her as well. She was not under investigation. The agents had been clear on that. Reyes had confirmed it to Olivia obliquely. But she had the look of someone who understood that their entire recent professional context had just been retrospectively contaminated, and who was trying to function anyway. She came into the bay at 4:31 with a tablet and a set of questions written on it, and the kind of careful composure that Olivia associated with people who were one unexpected thing away from losing it, but hadn't lost it yet. Nurse Brooks, she said. I'm Evelyn Marsh, deputy. I know who you are, Olivia said. Not unkindly. Evelyn Marsh looked at her tablet, then she looked up. I've been reviewing tonight's patient records and the incident reports that are going to need to be filed. She stopped. I've also been reviewing your personnel file. Your actual personnel file, not the summary that was in the active staff database. Olivia waited. There's a significant gap between what's in the active database and what's in the original application documentation. Evelyn Marsh set the tablet down on the counter. Someone edited your file, removed material. Olivia was quiet for a moment. When? The access log shows the edit was made 14 months ago, 1 week after you were hired. She held Olivia's gaze. The access credential used was Vaught's. The shape of the last 13 months rearranged itself again. Hale had looked at a file that had been stripped of its content and made assessments based on what was there. What was there had been curated to make her look like exactly what Hale had decided she was. The humiliations, the step-backs, the forgettable assessment in the staff review, all of it had been seeded by a file that had been deliberately made to produce that outcome. She felt something that wasn't quite anger. It was adjacent to anger, but flatter. The emotion you got when something that had felt personal turned out to have been engineered, and you weren't sure if that made it better or worse. I want the original documents reinstated, she said. That's already in process. Evelyn Marsh paused. I also want to discuss your current role and whether... Not tonight, Olivia said. Whatever that conversation is, it's not tonight. Evelyn Marsh looked at her for a moment, and in that look was something complicated. Recognition, maybe, or the beginning of it. Of course, she said. Whenever you're ready. She picked up her tablet and left. It was 5:12 a.m. when the second thing Olivia hadn't predicted happened. She was in the medication room doing a recount, the kind of routine accounting task she'd been assigned for most of her time at Riverside Regional, back when they were trying to keep her occupied with things that didn't matter, when she heard voices in the corridor, multiple voices, which was unusual at this hour, and with a quality that made her put down the count sheet. She stepped into the corridor. The voices were coming from the main bay entrance, and when she reached it, she found Marcus Teller and Grace Park and Sandra Reeve and 2 other nurses she recognized from the overnight secondary team, and they were all looking at something outside the bay's main window, the east-facing window that looked out over the hospital's main drive and the parking structure beyond. She moved to see what they were looking at. There were vehicles in the drive. Not standard vehicles, 2 black SUVs and a military-marked transport, and more personnel than had been in the building all night, moving with purpose through the hospital's main entrance. What's happening? She asked. Marcus turned. We just got the update from the federal team. The consulting firm Vaught was working with... They got the address from what he told them. They moved on it 40 minutes ago. He paused. They found a server room, the whole operation. Everything they were pulling out of hospitals, out of medical databases, out of military personnel systems, all of it's there. She looked at the vehicles. There were other hospitals, he said, not just here. Cedar Falls was one of 6 facilities they had access to. That's why the federal team was already staged. They'd been tracking the network for weeks, and Vought was the first person they'd confirmed inside it. She absorbed that. How many personnel records? She asked. They're still counting. He looked out the window. But they're saying hundreds, maybe more. Grace Park said quietly, Is that because of tonight? Is it because they got Vought talking? Partly, Olivia said, and partly because the network made a mistake tonight. They moved on an operation and one of the targets survived and came here. She watched the SUVs settle into position in the drive. They didn't know he'd ask for someone who would recognize what was wrong fast enough to keep everyone alive until the right people arrived. The bay was quiet for a moment. Sandra Reeves said, without looking away from the window, He knew, didn't he? Rourke. He knew exactly what he was doing when he asked for you. He knew he needed the best medical care he could get, Olivia said. That's not what I'm asking. Olivia looked at the window. The sky outside was beginning to change in the east. Not light yet, but the darkest part of the dark had passed, which was a different quality even when the color was the same. He knew where I was, she said. He'd tracked it. In case. She paused. And tonight was the in case. At 5:44 a.m., Victor Hale walked into the bay for what she understood, watching him, was going to be one of the harder things he'd done in a long time. He walked to each of the remaining patients in sequence. The secondary patients she'd been managing, the ones who weren't Rourke and weren't critical but were still in beds under Riverside Regional's care. He checked their charts. He spoke to each of them briefly. He made 2 medication adjustments and ordered a follow-up imaging review for the leg wound patient. He did all of this correctly. Then he walked to Olivia. I've been told, he said, that the internal review is going to include a full audit of staffing assignments and patient outcomes for the last 14 months. He held her gaze. I've been told I should expect to be asked about specific decisions, specific language. He paused. They already have the staff review recording. There was a recording. HR records all formal reviews, I forgot. A beat. Or I never thought it mattered. She looked at him. What do you want from me, doctor? Nothing, he said. I want nothing from you. I want to tell you that what I said in that review was wrong, not strategically, not tactically, factually wrong, said without sufficient information, and said in a way that caused harm I didn't stop to measure. He stopped. And I want to tell you that I know that saying it doesn't undo it. I'm not under the impression that it does. She looked at him for a long moment. There was a version of this moment that would have felt satisfying in a clean way. The moment of reckoning she'd been owed for 13 months, delivered formally, with witnesses. This wasn't that. This was a man who had done real damage standing in front of her at 6 in the morning looking like someone who was going to have to carry what he'd done for a long time, which was its own kind of consequence. I know it doesn't undo it, she said, but I heard it. She paused. The patient always comes first. You remember that? He looked at her carefully. You said it earlier tonight. It's not original to me. She turned back to the bay. It's what you teach the residents in their first week. I heard you say it in the corridor during my 2nd month here. I thought it was the truest thing you'd said. He stood there for a moment with that. Then he went back to work. At 6:15 a.m., Reyes came back into the bay with her colleague and Harwick, and the 3 of them had the particular energy of people who had been moving fast for hours and had arrived at something conclusive. Vaught's formal arrest processing is complete, Reyes said. He's been transferred to federal holding. The charges include conspiracy, unauthorized access to classified personnel information, and aiding and abetting a foreign-linked private intelligence operation. She paused. The consulting firm's principals are in custody. The server data is being analyzed. The 2 prior incidents, Olivia said, the soldiers who died. Those deaths are now classified as homicides for investigative purposes. The families have been notified. Reyes's voice was even, but something underneath it wasn't entirely. That's going to be a long process, but it started. Harwick said, The Army is issuing a formal statement later today about tonight's operation. It will reference the medical response at Riverside Regional. He looked at her. It will reference you specifically, Sergeant Brooks. I'm not a sergeant anymore. No, he said, but the record will reflect what you were and what that meant tonight. He paused. I'd like to speak with you this week when you've had some rest about a formal commendation and about what you're doing in this position and whether the Army has any interest in formalizing a support relationship. I work nights at a Level 2 trauma center in Cedar Falls, Colorado, she said. I'm aware of that. He held her gaze. I'm saying the Army may want to invest in that. She looked at him for a moment, not agreeing and not declining, because it was 6:15 in the morning and she'd been on her feet for over 10 hours and she wasn't making professional decisions under those conditions. This week, she said. He nodded. Reyes said, one more thing before we close out tonight. She held up her phone, an image, different from any of the others, a document scan. This came out of the server recovery. It's a personnel assessment, written, internal document. Whoever ran the network flagged high-value asset personnel at each facility, people they considered risks to the operation. She showed Olivia the screen. The document was 3 pages. On the second page, highlighted in the scan, was a section labeled Cedar Falls, Riverside Regional Medical. Under it, a short paragraph. She read it. The network's analyst had flagged one employee at Riverside Regional as a potential operational risk 14 months ago. Not Hale, not the attending staff, not anyone with access to the classified systems they were exploiting. The flagged employee was Olivia Brooks. The note read, background unclear, military connection possible. Recommend management through limitation of access and authority. If limitation unsuccessful, escalate. She read it twice. 14 months ago, before she'd done a single thing at Riverside Regional that should have attracted any attention from anyone, someone connected to a criminal intelligence operation had looked at her application and flagged her as a risk. And Vought had responded by stripping her file. And Hale had responded without knowing what he was responding to, without understanding he was being managed as much as she was, by keeping her limited, quiet, out of the rooms where she might see something. The entire 13 months. Not just negligence, not just arrogance. A managed campaign using Hale's existing tendencies as the mechanism, aimed at keeping her small enough to not be a problem. She handed the phone back to Reyes. They were right to flag me, she said quietly. I was a risk. Reyes looked at her. I'd say tonight proved that. Olivia looked at the bay, at the monitors and the patients and the residents who'd made it through the night, and the light that was beginning, finally, to come through the east-facing windows. She should have felt something clean and conclusive. Instead, she felt the particular texture of something large that wasn't finished, something that had broken open tonight and was still breaking, still revealing itself in pieces, and the pieces she hadn't seen yet were the ones she was thinking about. She was still thinking about them when Harwick's phone rang. He answered it, listened for 12 seconds. His expression didn't change visibly, but something in his posture shifted the way it had shifted earlier in the night when he'd looked at the federal agents. He lowered the phone. Rourke is awake, he said. He's asking for you. Olivia reached for her jacket. He's also, Harwick said, asking for Agent Reyes. Specifically, he says he has a name. He paused. Not one of the 9 Vought gave up. A different one. Someone higher in the chain. Someone who isn't in custody and doesn't know yet that Rourke is alive and talking. The bay was very quiet. Reyes said, How confident is he? He said, Harwick looked at his phone, he said he's been carrying the name for 3 weeks. He said he didn't tell anyone because he needed to be alive and in a safe location before he said it out loud. He looked at Olivia. He said the only reason he's both of those things is standing in front of me right now. Olivia picked up her jacket. Then we shouldn't keep him waiting, she said. The recovery room at Riverside Regional was not designed for the number of people who were in it at 6:23 a.m. There were the 2 recovery nurses who belonged there. There was Harwick. There was Reyes and her colleague. There was Marcus Teller, who had followed Olivia from the bay without being invited and without being told to leave, and who was operating on the apparent assumption that after the night they'd all just had, his presence didn't require justification. And there was Dale Rourke, who was in the bed at the center of all of it, looking like a man who had been taken apart and reassembled by people who knew what they were doing but hadn't had time to be gentle about it. He looked worse than he had in the trauma bay. That was normal. Surgery had that effect, the body's response to the intervention layered on top of the original injury, everything swollen and pale and reduced. But his eyes were the same as they'd always been, the kind of eyes that stayed sharp when everything else went offline. And they found Olivia the moment she came through the door. "You look terrible," she said. "You look like you haven't slept," he said. "We're even." She pulled the chair beside his bed and sat in it. Not the way she'd sat in Theo Marsh's room. Not the clinical position, not the distance-maintaining professional posture. She sat in it like someone who was going to be there for a minute. Reyes moved to the other side of the bed. She had a recorder out, small, physical, the kind that produced an admissible record. "Sergeant Rourke, I'm Agent Dana Reyes, FBI Joint Task Force. You asked to speak with me." "I know who you are," he said. His voice was rough from the intubation, and he paused to work some moisture into his mouth before continuing. "Vought gave you 9 names. That's correct? The man who runs the operation isn't in those 9. He held her eyes. "His name is Warren LaSalle. He's a retired defense contractor, former Pentagon procurement officer, currently listed as a private consultant with offices in Arlington and Denver." He stopped to breathe, controlled and careful, the breathing of someone managing significant pain without broadcasting it. He recruited Vought 4 years ago. The hospital network was his architecture. He identified high-value medical data targets specifically because medical records on active personnel are less protected than operational files but contain the same vulnerability mapping. Reyes was typing. Her colleague had his own recorder running. "How do you know this?" Reyes said. 3 weeks ago, I found a communications trail in a shared logistics system, something that shouldn't have been there, routing metadata from a network we used for supply chain coordination. Someone had piggybacked on it." He paused again. "I pulled the thread. It went to a shell company that traces back to LaSalle. I have the file structure, the access logs, and 2 voice recordings I made during a conversation I had with one of the intermediaries who didn't know who I was." His eyes moved to Harwick. "I didn't bring it to you because I didn't know how high it went. I didn't know if the channel I'd used to report it was clean." Harwick's jaw tightened. "You should have. Colonel," Rourke's voice was quiet. "I know. I'm telling you now." He looked back at Reyes. "The recordings and the file structure are in an encrypted storage service. I'll give you the credentials." He shifted against the bed, and the shift cost him something visible. "LaSalle doesn't know I survived tonight. His network would have gotten a report of the engagement, and in that report I would be listed as a casualty. He's going to find out I'm not dead, and when he does, he's not going to have time to act on it," Reyes said. "We'll move on him today, within the hour, if the information holds." "It holds." She nodded to her colleague, who stepped out of the room with his phone. Rourke looked at Olivia. "I told you it would get bigger," he said. "You told me to let you rest," she said. "You never listened." "I did what you asked. I told the right people." She looked at him steadily. "You did the same thing. You came here, you asked for the person you trusted, and then you told the right people." She paused. "That's what tonight was." He was quiet for a moment. Outside the recovery room window, the light was fully coming now. Not the tentative pre-dawn gray she'd seen from the trauma bay, but actual morning light, the kind that changed the color of surfaces and made the room look like a different room than it had been an hour ago. "The 2 from the prior incidents," he said. It wasn't a question. "The investigation is open," she said. "It's going to go where it goes." He looked at the ceiling. Something moved through his face that she didn't have a name for. Grief, maybe, or the specific weight of a thing that could not be fixed by any action, only carried. "Okay," he said, very quietly. She stayed in the chair until his breathing evened into sleep, which took 11 minutes, and then she stood and walked out. The corridor outside the recovery room was bright in the morning light. The hospital was shifting into its day shift rhythm. Different personnel, different pace, the particular energy of a building that had been through a difficult night and was transitioning into the ordinary work of the next day. She could hear it in the movement of people down the main corridor, in the change in the quality of the overhead announcements, in the way the light itself felt different now that it was coming from outside rather than from the fluorescent overheads that had been all she'd seen for the last 9 hours. Reyes fell into step beside her. "We're moving on LaSalle at 8 a.m., she said. "The credentials Rourke gave us are already with our analysts. If the recordings are what he says they are, this closes the top of the chain." She paused. "You're going to be asked to provide a statement about Vought, about tonight, about the conditions in the department over the last 14 months. It's not optional, but it doesn't have to happen today." "I know." "For what it's worth." Reyes stopped walking. She turned to face Olivia directly, which was a shift in her professional manner that Olivia noted. "What you did in there tonight. I've worked joint operations for 11 years. I've been in a lot of rooms where a lot of things went wrong. What you did with the information you had, in real time, without a full picture, that's not standard." She held her gaze. "I wanted you to hear that from someone who's seen the standard." Olivia looked at her. "You do the same thing," she said. "Different room, same process." Reyes considered that for a moment. Then she almost smiled. Not the polished professional expression she'd been wearing all night, but something smaller and more real. "Yeah," she said. "I guess we do." She walked away toward the main exit. Olivia stood in the corridor for a moment, and then she walked to the window at the end of the hall, the one that looked east, over the hospital's main drive and the parking structure, and beyond that the edge of the city, and beyond that the mountains that were fully visible now in the morning light, sharp and enormous and completely indifferent to everything that had happened in the building in front of them. She stood there for maybe 2 minutes. Then she went back to work because the shift didn't end until 7 a.m., and there were still patients in her bay. Warren LaSalle was arrested at 8:14 a.m. at his Denver office by a joint federal team. The arrest happened in the building's lobby, in front of the security desk and 2 administrative assistants and a junior analyst who had arrived for an 8 a.m. meeting, which meant it was witnessed and documented in the particular way of things that happen in public buildings with cameras at every entrance. He did not resist. He asked for his attorney, which was his right. He was walked to a federal vehicle in the building's parking structure and driven away. Olivia was not there for it. She was at Riverside Regional, doing the end-of-shift documentation that nobody liked doing, but that everyone had to do, because care without records wasn't care. It was improvisation, and she'd learned early that improvisation without documentation was where things fell apart on the second pass. She found out about the arrest from Marcus Teller, who found out from his phone, which had been buzzing since 7 a.m., with the particular frequency of someone receiving updates from multiple sources simultaneously. "It's on the news," he said. He was standing in the doorway of the documentation room with his jacket on and his bag over his shoulder, end of shift, which he'd earned about 4 hours earlier. The arrest, the network. They're reporting 6 hospitals in 4 states, classified military data, 2 deaths under reinvestigation. He paused. "They're not naming you. The military statement names Echo Medic, but they're not releasing your name." "Good," she said. She didn't look up from the chart. "You don't want—" "I want the documentation complete," she said. "The name can wait." He stood there for a second. "You know, most people in your position would want, after a night like this, after everything." "Marcus." She looked up. "What position?" He opened his mouth and then closed it. He thought about it. "Fair," he said. "I'll see you tonight." "If you're not late," she said. He left. She finished the documentation. The formal internal review at Riverside Regional began 11 days after the night of the operation. It was conducted by an independent team brought in by the hospital's board, not the administration, which had a conflict of interest that stretched across most of the management tier, now that Vaught's actions were documented. The board had moved faster than anyone expected, which Olivia attributed less to institutional conscience and more to the presence of federal investigators in the building and a news cycle that was not going away. She gave her statement on the 3rd day of the review. She sat in the same consultation room where Harwick had spoken to Vaught and Hale, the room with the particular energy it always had, the one that never quite cleared no matter how many times the walls were painted. And she answered questions for 2 hours. She answered accurately. That was what she'd told Hale she would do, and she did it. She described the staff review, the language used, the instruction to stay away from the trauma bay, the stripping of her personnel file, the pattern of assignments over 13 months. She described it without inflating it and without minimizing it, the way she'd have described a patient's symptom history. What happened, in what sequence, with what observable consequences. The review panel asked her at one point whether she believed Dr. Hale had been complicit in Vaught's operation. She said, "I believe Dr. Hale assessed me incorrectly based on information that had been deliberately manipulated, and that his behavior toward me over 13 months was unprofessional and harmful. I don't believe he knew about Vaught's network or that he was being used as a mechanism in it. Those are two separate things, and I think it matters that they stay separate." The panel noted it. Victor Hale's statement came the day after Olivia's. She didn't attend it. She was working her shift. She found out afterward, through the formal summary that went to all affected parties, that he had confirmed every detail she'd provided, added several she hadn't included, and had stated in direct language that the staff review recording represented language he stood by at the time and did not stand by now, and that the responsibility for its consequences was his. He had not been terminated. That was the outcome that surprised people who expected the review to go further. He was placed on formal administrative probation for 6 months, required to complete a supervisory conduct review with the medical board, and removed from his role as chief of emergency surgery pending a departmental restructuring. What that restructuring looked like was still being determined. Olivia thought about it when she heard it, and what she thought was, it wasn't the outcome she would have written, but the outcome she would have written would have let her use this as a clean ending, and clean endings weren't how things actually worked. Hale was a complicated person who had done real damage and was going to have to account for it in ways that would take longer than a review. That was its own kind of consequence. She'd learned over time to respect the slow ones. The 2 nursing staff members who had been present at the original staff review, who had heard her called forgettable and said nothing, received formal written reprimands and completed mandatory training on professional conduct and bystander responsibility. They were not fired. Both of them came to her, separately and awkwardly, in the 2 weeks after the review, with the particular discomfort of people who had to say something and didn't know how to say it. She listened to both of them. She didn't make it easier for them, but she didn't make it harder either. She let them say what they'd come to say, and then she went back to her patients. Dennis Vaught was formally charged on day 14 with 9 federal counts, including conspiracy to commit espionage, unlawful access to protected health information, aiding a foreign-linked intelligence operation, and 2 counts of accessory to conduct resulting in death. His attorney entered a not guilty plea, which was expected. The trial date was set for 11 months out. The federal prosecutors, Reyes had told her, were not concerned about the outcome. Warren LaSalle faced 17 counts. His attorney was better than Vaught's, and the process would be longer. But the recordings Rourke had made, the voice documentation from an intermediary who hadn't known who he was talking to, were, according to the federal legal team, exactly the kind of direct evidence that closed arguments rather than opened them. He was denied bail on the grounds of flight risk. He sat in federal holding while his attorney filed motions, and the motions were denied, and the process moved forward the way federal processes moved forward when the evidence was unambiguous. Olivia followed none of it closely. She knew what she knew from Reyes, who called her twice in the first month with updates, and then transitioned to email, and from Harwick, who was a more consistent presence than she'd expected. She read what she needed to read and didn't seek out more because the legal process was not her work, and she'd learned a long time ago to stay in her lane when someone else's lane was what was needed. Her lane was the emergency department at Riverside Regional Medical Center, and it had changed, not overnight, not in the dramatic way of things in stories. It changed the way real things changed, which was gradually and unevenly and with friction. The departmental restructuring that followed Hale's removal from the chief position created a temporary leadership vacuum, and in a temporary leadership vacuum, things that had been held in a fixed arrangement began to move. Marcus Teller started asking questions in briefings that he wouldn't have asked 6 weeks earlier. Not aggressive questions, just real ones, the kind that came from a resident who had seen what competent emergency medicine looked like under pressure and had adjusted his baseline accordingly. Grace Park had a conversation with the new interim department head about the nursing staff's scope of practice that she later told Olivia had gone significantly better than she'd expected. Sandra Reeve, who had been a charge nurse for 9 years and had the particular stillness of someone who had seen a lot of things and had opinions about all of them and expressed those opinions selectively, told Olivia one morning near the end of their shared overnight that she'd put her name in for the departmental trauma coordinator role that had been posted in the restructuring. "You'd be good at that," Olivia said. "I've been doing it informally for 4 years," Sandra said. "I thought it was time someone paid me for it." Olivia had not been asked if she wanted a new role. She had been asked by Harwick, by Evelyn Marsh in her new capacity as interim administrator, and eventually by the board's restructuring committee, about her experience, her background, her assessment of the department's gaps. She'd answered the questions directly, the way she answered all questions, without reading too much into why they were being asked. 3 weeks after the review concluded, Evelyn Marsh called her into the administrative office and made an offer. The office was different without Vaught's things in it, plainer, with the particular stripped quality of a space in transition. Evelyn Marsh sat behind a desk that didn't have the same weight as it would have had under different circumstances, and she had the look she'd had the night of the operation, the one that meant she was managing significant context while still doing the necessary work. "Director of Trauma Education," Evelyn said. "It's a new position. We're building the structure from the ground up. The scope would be developing training protocols for the trauma team, partnering with the Army medical program that Colonel Harwick has been discussing with us, and establishing a curriculum for residents that integrates field medicine practices with our existing emergency protocols." Olivia looked at the offer letter on the desk. "That's a large scope." "It is. I still want to work nights." Evelyn Marsh blinked. "I'm sorry?" "The director role. I'll take it, but I want to keep nights as part of my schedule. Reduced? Not full-time floor nursing, but regular patient contact." She looked at the desk. "I'm not useful if I'm only managing. I need to stay in the room." Evelyn Marsh looked at her for a moment, and in that look was something Olivia had seen a few times in the last month in the faces of people who had expected her to want the thing they were offering to mean something other than what she was saying it meant. They expected vindication to look like elevation. They expected her to want out of the room that had held her small. But the room wasn't the problem. The room was where the work was. "That can be structured," Evelyn said. "It might take some creative scheduling." "Sandra Reeve is taking the trauma coordinator role," Olivia said. "She'll handle the scheduling. I haven't officially, but she's the right person for it." Olivia picked up the offer letter. "And yes, I'll take this." The formal military commendation came on a Tuesday in the 4th week, in a ceremony that Olivia had been told about and had agreed to attend only after Harwick had confirmed it would be small and not in the hospital's main atrium where the original notification had suggested it might be. It was in the hospital's 3rd-floor conference room, the one with the long table and the window that looked over the parking structure. Present were Harwick, 2 other officers she didn't know but whose rank she registered, Evelyn Marsh, the board chair, and a handful of people from the department. Marcus Teller was there. Grace Park was there. Sandra Reeve was there in the particular way Sandra Reeve was anywhere, which was present and attentive and clearly filing everything away. Dale Rourke was there. He was 6 days out of the hospital, discharged against Dr. Soul's recommendation for timing, though not against her recommendation on clinical readiness, which she'd confirmed with the particular reluctance of someone acknowledging that the patient was going to leave no matter what she said. He was in uniform, which was the first time Olivia had seen him in anything other than a trauma bay or a hospital bed, and he looked like himself in it in a way that was harder to describe than she'd expected. Harwick read from a formal commendation document. The language was the language of official military recognition, specific, precise, without flourish. It named the actions of the night of November 7th at Riverside Regional Medical Center. It named 5 personnel whose lives had been directly preserved by emergency medical intervention. It named the intelligence contribution that had led to the arrest of Warren LaSalle and the dismantling of a 6-hospital intelligence network. It named Echo Medic. When he finished reading, he handed her the commendation document, and then, in a movement that was not part of the ceremony, not listed in any protocol, he came to attention. The 2 officers beside him did the same. Rourke came to attention. She hadn't expected it, which was the only reason it moved her the way it did. She'd managed everything else the night had brought without losing her composure, not because she was impervious, but because there had always been something more urgent than composure to attend to. There hadn't been a moment where it was just this, just people standing still and recognizing the thing she'd always been, that she'd never asked anyone to see. She held the document and she stood straight and she let the moment be what it was. It lasted about 12 seconds. Then Harwick dropped the stance and said, "The Army would like to formalize the training partnership with Riverside Regional's new trauma education program." And the ceremony moved into logistics, which was where most ceremonies eventually went, and the moment became part of what had happened rather than what was still happening. Rourke ended up beside her near the window while the others were talking through scheduling frameworks. "You could come back," he said. Not pushing, just stating. "Come back where?" "Active consulting, at minimum. There's a program. Dale." "I know." He looked out the window at the parking structure. "I had to say it. Now you've said it." He was quiet for a moment. "How's Marsh, the kid?" "He's going to be fine. He actually came back to the hospital 3 days ago, not as a patient." She paused. "He brought coffee for the night shift nursing team and stood in the corridor looking like he wanted to say something for about 15 minutes, and then he just gave Sandra the coffee and left." Rourke almost smiled. "He's a good kid." "He's going to be okay," she said. "Yeah." He looked at her. "So are you." "I was always going to be okay." "I know that," he said. "I just wanted to say it in a place where you could hear it clearly." He held her gaze for a second. "You were always going to be okay, Olivia. You just had to wait for the right night." She looked at him, at the scar along his jaw that was older than anything that had happened last week, and the new pallor in his skin that would take months to fully clear, and the way he was standing with the particular careful economy of someone managing pain they weren't acknowledging. He was going to be difficult through his recovery. He was going to push his timeline and ignore at least 2 medical recommendations and probably be somebody else's problem in an emergency department in some other state before the year was out. He was also the person who had tracked her to Cedar Falls and held onto her coordinates like a contingency plan, and when everything went wrong, had come through her doors and made it possible for the right night to be this one. "Get some rest," she said. He shook his head slightly. "You always say that? You always need it." He left. The room emptied gradually after that, the officers, the board chair, Evelyn Marsh, until it was just the people from the department, and then just Olivia by the window. Marcus came to stand beside her. He didn't say anything for a moment, which she appreciated. Then he said, "Can I ask you something?" "Probably." "When you were working the bay that night, when you stepped in on Rourke, when Hale told you to step back, were you scared?" She thought about it. The honest answer, not the clean one. "I was calculating," she said. "Fear and calculation use the same space sometimes. You can't always tell which one you're doing until later." "What does it feel like when you know you were scared?" "Like relief," she said, "because it means you understood the stakes." He nodded slowly. "I want to be better at that, at staying in the calculation when things are moving fast." "You were better than you think you were that night." She turned from the window. "You handed things before I asked. You adjusted without being told why." She looked at him directly. "That's not something I can teach. That's something you already have. The rest is experience." "Is that what the training program is going to cover?" "The training program is going to cover every technical protocol I know, the full field medicine curriculum, and tactical triage sequencing," she said. "Whether someone actually develops the instinct for it." She shrugged. "That's between them and the work." She picked up her commendation document from the table where she'd set it down and walked out. She stopped by Rourke's now vacant recovery room on her way to the department, not for any clinical reason, just to stand in it for a moment, the way she sometimes stood in rooms after patients left, taking a second to acknowledge that the room had held something significant and was now empty of it, and that was also its own kind of completion. The room was clean, the bed remade, the monitors quiet. She looked at it for exactly the amount of time it took to understand what she was looking at, and then she walked out and went to work. The emergency department at Riverside Regional at 5 p.m. on a November Tuesday was not a chaotic place. It was mid-shift, mid-week. A dislocated shoulder in Bay 1, a pediatric respiratory case in Bay 3, 2 intake assessments pending, the steady accumulating rhythm of a department that took care of the people who came through its doors. Nothing extraordinary. Everything necessary. Olivia walked in, picked up the first chart, and read it. She'd been here before, say it. This exact moment, the start of it, the chart in her hand and the work in front of her. She'd been here dozens of times over 13 months, carrying things no one in the room could see, doing a job that had been sized down to fit what they decided she was. The chart was the same weight in her hand as it had always been. The room was the same room. What was different was everything that had always been true about her, now acknowledged in the place where it had always been operating. That was what people didn't understand about the quiet ones. Not the ones performing quietness, not the ones who'd been silenced, but the ones who had chosen the long game because they understood that the moment of reckoning wasn't something you manufactured. You worked. You stayed. You did the thing that needed to be done the way it needed to be done, every time, without waiting for the room to see it. The room always caught up eventually. It just sometimes needed the right emergency to do it. She looked at the chart. She put on her gloves. She walked into Bay 1.